The purpose of this presentation is to help inform, hopefully, early childhood development research. I'll give a little bit of background of the objective for today's presentation. Basically, we want to help bring a bigger shared research agenda that really maximizes impact for children, families, and the broader ECD sector. So the more we share between each other, those people in the sector who have different lenses, different approaches, and different understanding of the evidence, I think the more we're going to be able to have a very coherent narrative around where the research needs to go and where the biggest gaps are. And in particular, this is meant to hopefully contribute to, or at least influence or inform a James Lind Alliance research prioritization exercise, which I don't know if, Michael, you're going to say a few words about that, but I know that the original conversations we had about this was to see whether this can help with that prioritization exercise. So because of that, the outline for my presentation will give a little bit of background and the approach we took, which is a very much of a pragmatic and tailored approach to this review. I will very briefly talk about some of the key takeaways, but want to focus most of this presentation on those gaps, because I think that's where we can most, contribute to that research prioritization exercise, and where I think I would love to hear from those online with us after, when we open up for the discussion, about have we missed anything big? Is there anything else that needs to be highlighted there as well? So a few words on the background. So the project came about through a collaboration with a group of funders in the UK. You can see many of their logos here on the screen. These are funders who are all funding some component that relate to early childhood development in the sector here in the UK. And there's a push for them to essentially, from them, in fact, it's initiated by them, to be more closely connected with each other. So they know more about each other's work, they understand each other's priorities, their ways of working, who they are funding, what they are funding, how what their processes are, but also so that they can identify areas where they could collaborate, align, and really, in a way, try to see if they can join forces to have a bigger impact in the sector. And as part of that exercise, they reached out to us at Better Purpose to do a bit of a targeted review of evidence that looks at what works in improving child outcomes, family outcomes, early ECD outcomes generally, but also with a focus around how we know that works, the context around it and all of that, and what some of the key gaps remain, so that could inform their own investments in the coming year and beyond. So what we've done is we have a report, which is a very, very high-level report. It's not your typical academic paper, just FYI. It's very visual. It really pulls out some of the key themes, but it is accompanied, for those of you who are interested and kind of more nerdy into the details, it has a database. So on this QR code, that links you to the website where you can download the report, but also the database. The database has a full list of all of the reports we've reviewed for this exercise, as well as some data sources that we looked at that could be useful. And we hope, in fact, maybe this is something we can talk about at the end, that this is just a beginning. So ideally, we would like this to be something that continues to be updated as more reports get published, as our kind of understanding of the evidence grows and changes, so that it can still be useful for this group of funders. Now, we decided to make it public because we think it's not just useful for funders, right? It's useful for the sector to see this organized and talked about in this way. And already we've seen it picked up by charities and by other groups because it's been made public. So hopefully you'll find it useful as well. Okay, so what is this report and what is it not? So it's very much a targeted review of the existing evidence. As I mentioned already, we took a very pragmatic approach to target the desk research, and we did some interviews of key stakeholders as well, so that we can explore what we know about what works to improve childhood outcomes and how those things work, but also what the key gaps are. This is a very much of a high-level summary that represents our high-level interpretation of that evidence. We do acknowledge that other voices, including those of implementers on the ground and beneficiaries, would add a lot of valuable nuances and perspectives to this. And so the caveat is this is very much me sitting on my sofa at home, reading through all of these reports, extracting what I think are some of the key findings, and then putting this back into this report for you. So that's my big caveat. It is not a systematic review of evidence. We didn't have the time or the resources to do that, but also I don't often find that those are always the best way to get to the bottom of what the evidence says. But it was very much us looking at thinking what are the big publications, what are the big evidence reviews out there that we know of, what are the big papers that we know the government is using to inform their policies, where do people in the sector turn to when they're looking for evidence on what works and how. And we came up with an initial list of about 50 publications that within our team, Georgie and I thought, these are really, really important pieces that we want to make sure we include in our review. And that included things like, for example, the EEF, the early years toolkit, and, some of the things many of you will be aware. So these are not just peer-reviewed articles. These are kind of things in the public domain that we know talk about the evidence of what works and how, and ideally kind of summarizes it for us because we had a limited time to do this. We shared this list with a steering group, the steering group that was a kind of a subgroup of those funders who were funding this work, so that they could add to it. So we ended up with a list of 167 publications for consideration. We have the full list in the database I mentioned. We also came up with a list of 17 data sources. These are data sources that are, in most cases, publicly available. Sometimes they're updated on a yearly basis or less frequently for some and more for others. And the idea behind these is to say, okay, these resources are available for people to analyze, data that you could analyze to answer some research questions on these themes. And so hopefully that could grow as well. It's not a comprehensive list. And then what we've done is so I looked through all of these publications, and we retained 105 for more detailed analysis and mapping against key outcome areas. And then once I kind of extracted some of those key themes, we had some interviews with experts where we kind of validated and explored these initial findings to try to see if we were missing something important, basically. So that's the approach, that's the methodology that we used. In the report, we highlight some key reports which are clickable. So, you could click on them and they link you to these reports, and also some details about why we think these particular reports can be particularly useful for certain things. In some cases, it's because of the depth with which they're really looking at the how or the tools or things like that. Yes, do you have a question? Oh, it's just somebody not on mute. So just make sure you put yourself on mute if you can, so that people don't get disturbed.
Sorry,
so this is available. Yes, thank you. This is available in the report. I won't say very much more about that. I just wanted to flag that in case you're interested. So let's dive right into the key takeaways. So these are kind of the key themes of what works and how. I don't think there's any big surprises to everybody probably on this call, or anybody who's kind of worked in the sector and understands the evidence a little bit. But first of all, when we think about outcomes and solutions, it's really not a good idea to be quite narrow in our thinking, and should not be considering these in silos. So we will go through in a second over the common outcomes framework, which we used as a basis for our analysis, which divides child and family outcomes in kind of health and learning and kind of like happiness and things like that. So it makes it sound like these are quite separate, but they are not. In fact, they're quite interconnected and interrelated with each other. And the context in which interventions are implemented in real life is very complex and, again, interconnected. So it is not a sector where we can easily kind of very narrowly look at a specific outcome area or a specific intervention without it being connected to other things. And doing that is quite unhelpful because then you're trying to kind of identify key variables that, can have a direct impact, but then you're extracting those from the real life environment in which we're seeing them and that they demonstrate themselves. So I think it's important to just remember that none of this works in silos. There needs to be a focus on supporting parents and carers, and I'll get to that in a second, to provide an enhanced and good home environment, which is a huge, huge predictor of how well children and families fare in the long term. And this needs to be achieved through successful implementation. Implementation is hard. It's really, really hard to do well, and we need to learn more about that, but also really strong system enablers, which are not always in place, especially in the current kind of climate with very restricted financial resources. So these are the 5 areas at the top: safe, healthy, happy, learning, and engage. These are the 5 kind of areas of outcomes identified by the Common Outcomes Framework, and which you saw the wheel a little bit earlier. Now, these areas, each one of the papers that we reviewed, we kind of mapped them against which one of these areas were they kind of looking at in the research that they were reviewing or that they were speaking about. And it turns out that the 2 areas where there's the most research and the most papers about are around that kind of healthy and the learning, kind of school readiness and kind of the learning component. But the other 3 are much, much less focused on in the research. So already we're seeing some gaps. And it was interesting because we mapped these against the funders' priorities. And it turns out that, again, that most of the funders were most kind of prioritizing those areas where we already have a lot more evidence and research on. So it's interesting to see that kind of disconnect there. So, but again, I think it's unhelpful to think about these too much in silos, and we need to remember that they're very much interconnected. A lot of the research actually tackles more than one of these, which is a good thing, I think, and more of that should happen. Now, in terms of the main key takeaways, so the first one around that parent-child relationship and the home environment. Now, these have the greatest influence on outcomes. No surprises here. Also, no surprise that this is often restricted by poverty, which itself has multiple facets. Therefore, those more holistic and place-based solutions are more likely to succeed because they target more of these multiple facets and can really meet the parents and families where they are in their home and in their environment. But these kinds of approaches take time. There's a lot that we can learn from them. Programs like Better Start and Family Hubs and early learning communities and back in the day, Sure Start and all of these things. Like, we can learn a lot about those, but we know they take time to implement. They take time to really tailor to the needs of the communities and the families. But really, really a strong, becoming even stronger set of evidence now that this is a really promising area for positive outcomes. So the second area is around implementation. Interventions are often found to be more successful on a smaller scale, but then when we take them into real world contexts, they're less successful, or in a larger number of communities or nurseries or families, it becomes more difficult. So sometimes what's important, and we did some work with a multi-academy trust in their nursery settings, and speaking to one of the heads there, he was telling me, we're taking some of these programs that have been vetted, say, by the EEF or something, and they don't just apply them as is because they don't quite meet their needs, and they'll pick and choose components from those interventions and then change them around so that they can better, implement in their own context and meet their needs. And so I think that identification and testing of what are the core practices and principles that can more flexibly be adapted to different contexts and embedded actually in everyday practice. And in the literature, we see this as like principled adaptation or program fidelity, and the extent to which there's core elements of a program and then optional elements. So this is a promising approach. Some people, there's the early years library doing this, and the early years evidence store to some extent as well. So I think this is a promising area. And then finally, the third component is around systems. We know that early childhood needs to be prioritized at the system level. And there's a key kind of barriers or places where in particular this tends to break down, where there's a need for more work. So there's this idea of building strong partnerships and coalitions around the sector so that there's better alignment. And I know, for example, all of the work that that came around this common outcomes framework is to try to get a coalition around what do we mean by positive outcomes for children and for families? How do we all speak the same language around that? Or the coalition around the funders group, right? How do we make sure all the funders are kind of sort of swimming in the same direction and we're all trying to improve the system and ECD together in a way that speaks to each other and that can be potentially more strategic than if we're all kind of looking at different components and then not linking and joining it back together. So having this alignment for a vision for the sector and how we can measure progress is important. And this whole thing around better data sharing. I mean, early childhood is across multiple, I guess, departments at local authority levels and at the national level, and better kind of sharing of data between these different components will help with implementation greatly. And that's been a big barrier so far. So what we found in terms of what works to improve children's outcomes. Now, this is a huge, it's a lot of text, and it kind of brings together a lot of data from the report. And so please do go directly to the report to look at the details that sits behind this and how we kind of how we assessed whether there was a lot of evidence, substantial evidence, or something where we need kind of, there's good promising evidence, but we need more evidence. And also the report goes into the how. So for example, so if I take a couple, so on the safe side, we have, prevention services like parenting interventions, for example, or approaches to reduce domestic abuse through community-based intervention or home visiting, things like that. We know there's good evidence that is emerging on all of these things, but the report also goes into the how meaning like what needs to be in place for these things to work. I just don't have time to go through all of that today, but the report has some of that. Under the healthy category, we have things like breastfeeding support through group or individual interventions. We've got, approaches for improving child nutrition, like school breakfast clubs, for example, but there's also home visiting programs. There's all these interventions around supporting maternal health and that mother-infant relationship and this idea of helping families develop those secure attachments, between the child and the caregivers. So there's a lot of different interventions that were reviewed and that are kind of described, especially also in the how as well. There's a little less, as I was mentioning, on the happy. So this is the social, emotional, personal well-being area that kind of made it into our final review list. But for example, high quality early childhood education provision can really help with children kind of develop those social, emotional, and personal well-being. There's also parental interventions, and there's some evidence around structured music programs as well coming up. So there's some things there really interesting to look at. On the learning, I would say the learning is by far where there's the most evidence, the school readiness and kind of focusing on children's cognitive kind of more development learning of speaking and learning to read and early kind of numeracy, those things. So again, there's parental interventions, but also programs promoting explicit teaching pedagogy. There's also quality, obviously, ECE through workforce support and staff preparation and training and support, and wider policies aimed at improving universal access to quality early childhood education. So all of these things have been shown to have a positive impact on those types of outcomes. And then finally, the last category is around kind of feeling engaged in a community, this engaged category. So things like enhancing parent and child relationships with psychological interventions. There's also kind of that attachment that falls in here. And there's a whole piece around fathers, and it's still emerging. I think there's definitely, as we'll see, gaps around the role of fathers and how to support fathers, but there's something there as well. And community engagement and doing things within the community and the holistic approach and place-based interventions fall under this category as well. As I said, that's a very quick whistle-stop tour of the all of these interventions that are grouped together. The report has a way of describing them. Hopefully, you'll find that helpful, and you can go and dig into some of the details that hide behind this one slide that I wanted to show you. I do want to spend a little bit more time on the key gaps because I think for the conversation and speaking with Michael, that's where it was going to be most helpful as well. To identify the key gaps, what we did is we looked at, again, for each category of outcomes, we looked at those reports, and those reports often finished by saying, okay, we've got all of this evidence on X, Y, Z, but we still need more evidence on this, or, you know, we still need a lot more investment or a lot better understanding on this. And what we've done is we tagged all of these and then we categorized them across these different areas. Some of these slides have a lot of text. I won't read it all. It's just to give you a flavor. So on the safe side, so this is around children needing to have a secure shelter, be physically safe at home, at school, in their community, be protected from severe and immediate threats to their health and happiness and well-being. So that's the broad category of outcomes here. So there's a lack of understanding still of the delivery and effectiveness of early help, which takes time to measure, and it can be tricky to measure that. The lack of research on maltreated children as well, especially looking at cohort studies rather than relying on reports about officially registered cases, because sometimes these cases don't get reported, and so we need to understand more behind the why of that and how. There's a whole piece around digital services and in-person services and this kind of everything that's long-term. There's a big gap around understanding what long-term support can look like, what long-term effects of things like home visiting interventions will be, because most people are too impatient to wait for longitudinal study results. So a lot of it is short-term at the end of 6 months, at the end of 1 year. But what about 3 years later or 10 years later? You know, there's a big gap there across all of the outcome areas. And then there's a piece around tackling early childhood or adverse childhood experiences in the UK context. There's a lot of research in the US and less in the UK. And then the report has some example follow-up research. And these examples, again, not meant to be comprehensive. These are ones taken directly from the reports that we were reviewing. And we thought, okay, these are some examples. And in particular, thinking about, you know, the funders, these are the kinds of things that you might want to look at. So this rigorous longitudinal research for family hubs is one example. And hopefully there will be more and more of these as well. The second category is around healthy, so being protected from preventable disease, free from chronic illness, having healthy lifestyles, nutrition, exercise, all of those things, and also have good mental health. So some of the things that were highlighted in the literature as key gaps included things like interventions in the workplace for new mothers, huge transition for them, and a lack of understanding of how best to support them. An understanding of the social and environmental factors around kind of long-term change for tackling health outcomes, work around minority ethnic families, again, that digital piece here and the long-term impact. So there's some ideas here on the right-hand side about some potential follow-up research, including doing a little bit more work looking at different early childhood services across the 4 nations here in the UK and internationally. There's a little bit of that research going on, but I think there's huge value in looking at what's being done elsewhere, and not necessarily to copy, but to understand potential pathways to impact that may not have been considered in our context, and the why behind that and how it might be applicable. Next, don't know why it's not. Okay, there you go. Happy. So all children should have their social needs met. So relationship with others, they need their emotional needs needs met. So relationship with their own self, and have their personal needs met. So being mentally stimulated, able to pursue their own interests. And so there's certain areas, kind of areas of outcomes like creativity, critical skills, expressive arts, those kinds of things have been under-researched, and there's a bit of a gap in that area. Understanding kind of that creative pedagogy and the impact of that and what it takes for to deliver that kind of pedagogy. Of course, there's again that piece around digital technology, more research around structured music program, and again, we'll see the theme about the minority ethnic families come back across multiple of these outcome areas as well. Often the social and emotional and well-being outcomes are not included in evaluations of interventions in settings. So there are many, for example, RCTs or impact evaluations that look at certain areas and often just don't include this. So including this more often is one area that I think is needed, and that's been highlighted in the research. Okay, the next one is learning. That's the one where there's the most research, and also where there's been the most kind of people saying, oh, but we need more research and more understanding of this. So there's a longer list here. So this is in terms of gaining knowledge and skills that children need for later childhood and adult life. So academic, practical, personal, all those things, but also developing their own interest and talent, and to be able to learn how to learn in the long term. So more understanding about what happens at home. So it's very difficult to get to that. You know, there's some surveys and there's some ways of getting to the parents, but little response rates, and we don't know how to interpret self-report. And so there's something around better understanding how learning happens at home, and also with the role of fathers, changing, for example. So there's a lot around that. Digital technology coming back as well. Something about how to best support ECE, so early childhood education staff, to engage with parents, and so that there's a better connection between the learning at home and the learning in the nurseries, for example. We have a lot of data and evidence around effective interventions at small scale, but we know that at larger scale, it doesn't always work, or the interventions don't turn out to be as effective. So understanding of the why behind that, more research for children under 2 years, and around policies and about longer term impacts as well. So there's a list again here of possible follow-up research with that as well. The last one is around engaged. So children should be happy with their friendships and have family they get on well with and are happy with their family life. They, want to feel like they belong to a group and a community and have things to do and places to go in their local areas. So here there's a lack of long-term follow-up research. Some of it is coming out. Some came out actually after this report was published. So some of the Sure Start longer-term reports and evaluation came out recently. We need more of that, and we need more around fathers, as I said, their role, especially in terms of single parents and blended families, but also like the role of non-resident fathers and the importance of that. And what happens after parents get separated, for example. And so, so we need definitely more of these kind of more longitudinal research and understanding all of the different kind of roles in the family and the community, and using that kind of common outcomes framework to look and co-create with communities some of these locally relevant place-based approaches to reach these overarching goals. So again, very quick kind of whistle tour here. What we do have in the report, I don't expect you to read this, but often the reports we reviewed had specific research questions that were left unanswered, that were, these are research questions we still need answers to. And we just basically extracted them and created an ongoing list, which hopefully can be helpful, Michael, to your team as you're doing the prioritization exercise. So I'm showing this slide to say there's a whole section in the report that does this, and I think it's in the appendix. So do take a look, hopefully it can be helpful. And of course, some of the themes in there you will recognize from some of the slides I was just showing. So that wraps up my discussion. I'm just posting again the QR code in case you want to see the report and you didn't get a chance to do it at the beginning. But I would love to open up for any questions and discussions, any ideas, any thoughts this provoked. I don't suspect this was surprising to anybody, but yeah, would love to hear more. So I'm going to stop sharing my screen so I can